88.7. I'm JJD, and I'm glad you're tuned in this morning as we get into our final week of launching 2022, right? Is our health and safety week, and we've been joined by the lovely Dr. Cherish. Let me just hint you that from the month of February, you're going to be hearing her a lot on the I Am Drive. Why am I saying so? Because she is going to be bringing us our health tips on the I Am Drive. Dr. Sally has been with us for so long. She's handed over the baton to Dr. Cherish. We're looking forward to having her on at 7:15 Monday through Friday on the I Am Drive. Dr. Cherish, thank you for making the time to join us this morning.
You're welcome.
All right. So I think I'll need to get a little closer.
Closer.
I think that's much better. Dr. Cherish, people boast, they're proud to say, it's been 2 years and I haven't had to enter a hospital. I haven't had to go see a doctor. If I've been, there was just to visit somebody who wasn't well.
Yeah.
And I know you are a believer. You're a lady pastor. I know you're a believer. You're also a doctor. I want to know, as a believer and a doctor, when you hear the statement, how do you feel about it? What do you think?
Well, there are mixed feelings, really. One is that, great that you've not been unwell.
Mm-hmm.
But, as a doctor, I'm thinking that is really out of more of a lack of understanding of what the hospital is actually supposed to be.
Mm-hmm.
It kind of reminds me of a verse where Jesus was like, my temple is for prayer and not for selling,
Remember, we're live on Facebook, so you can join us this morning.
So the hospital is not supposed to just exist for just receiving you when you are unwell and when you're like seriously sick.
Mm-hmm.
But we're supposed to be serving you to preserve your health. And that's the best way, basically, to look at your health. That what do I need to do to preserve how well I am now, and to make sure that that's, lasts for a long time, and then also to prevent you from spending a lot more money in the future on the very bad complications that can come out of things that you can pick up early. So those are the mixed feelings. We're happy for you that you've not been unwell, but at the same time, we're concerned that we're not prioritizing maintaining and preserving your health to go into the hospital and check yourself out while you're still feeling well, which is the definition of medical screening, really.
So prioritizing, maintaining, and preserving your health. These are very important, and which is why we've invited you here this morning to help us know how to set ourselves on a good path to attaining that this year. So we want you to touch on some essential health checks you think we should pay attention to. You are in the medical field. I remember I tried to arrange something with you. Said, no, I have this and so clinic. You know what's happening. You're in that field.
Yeah.
What are your recommendations for this year for us?
Well, I think it's really smart to think about what are the top things that are killing us.
Yeah.
The top things, and number one is has to do with cardiovascular disease that really comes out of what we call metabolic syndrome. That's the hypertension, the diabetes, and the high cholesterol. That's actually what's killing most people in the world. 70%, 70 to 80% of what's killing most people is preventable. And the number one I mentioned is related to metabolic syndrome. And 2/3 of all of that is happening in our kind of place, like low to middle income countries like Ghana. So I would say that if you're going to do any health checks, that you need to be checking your blood pressure. You need to be checking your sugar level, and you need to be checking your cholesterol. These are the top 3 things that you need to check from time to time. It's recommended that if you are below 40 years old, like 18 to 30, you should be doing like regular health checks 2 to 3 years, every 2 to 3 years.
Every 2 to 3 years.
And between 30 and 50, you reduce it to every 1 year, every 2 years.
So I should be doing every 1 year.
Yeah, basically. And then after 50, then you need to really be doing it. Every year you need to do a health check. And so basically the 3 things I've mentioned are going to be part. If you walk into any hospital and say, I want to do a health check, Those are like the three top
Okay.
things, and it'll be part of things that are being asked of you to do.
Okay.
Of course, there are going to be other things based on your age, your sex, where you work, your ethnicity, your risk factors, as in your family history.
Mm-hmm.
So the doctor is going to be listening to all of that, looking for, okay, what other things should I add? But just for you to know as a lay person, and to know that these are the things that are really killing us. With the hypertension, diabetes, and the cholesterol, which is what makes it worse.
Oh.
These are things that you can check yourself.
Okay.
They're painless, painless to check. And they're
The
just going to say,
cholesterol, for the cholesterol one.
yeah, for both checking your BP and
Blood
your
pressure
sugar. Well,
process.
I mean, I guess it depends on your pay level, because the cholesterol and diabetes sugar check is
Just a little
a
pinch.
prick, yeah, basically, and you'll know basically instantly.
Mm.
Of course, so these are the general ones. So I
Okay.
can tell you what you should look out for as a woman, what you look
Fantastic.
for out
That's
for as a
important.
man, and then maybe children.
Yes. Please touch on all those
All of
areas for
them.
us. Let's start
Okay,
with our women.
So women, ladies first.
Thank you.
Women, you want to be concerned, not concerned, overly concerned as in you're worried, but basically, maybe I should mention, when we're talking about the health checks, it can either make you a really nervous person, or it can make you
There have been
someone
times I've
who's
been to the
like,
hospital and
yeah,
I was so nervous. My heart
Yeah.
started racing.
But I mean,
You
coming
know those
from
kind of tests that it's either a positive or a negative. You're like, Lord,
that's going to be possible.
Lord.
Let's see. But I mean, coming from a Christian
Mm-hmm.
perspective, we know that we are entitled to health. I mean, that's why Christ died, that we should live unto righteousness, by whose stripes we're healed. So in doing these health checks, your mind is that I am determined to
Okay.
have
To have
what
good
belongs to me through Christ.
Okay.
And so it's more of like a determination.
All right.
And you're not going to be ignorant. Even the Bible says, don't be ignorant of his devices. So when it comes to your health, you shouldn't be ignorant. You should be a step ahead and be a fighter and say, I'm going to check and make sure that even if there's anything, I've picked it at the earliest possible time,
Okay.
that I have more of a chance, or more of a how do you
Upper
call
hand
it?
or something.
Yes, an upper hand to make sure that I beat this thing, because
Okay.
this thing is not going to beat me.
Mm.
So with the ladies, we're talking more of the cancers, because
Okay.
the top cancer, of course, is breast cancer, followed by cervical cancer, and then the other cancers. So for the ladies, you want to do, if you're younger, 30 below, around there, with the breast cancers, you could be doing the self-breast exam.
Okay.
At my clinic, when you come in, we'll do the breast exam for you. But what's recommended is an ultrasound for the younger people, and then just a little older, we start doing the mammograms.
All right.
Just because one of the things I've experienced is that once you can feel a lump, it's actually a little, let me say, too late. Once you can't even feel it. So what
Okay.
we're trying to do is pick it when you can't
When
feel
you can't
it.
feel it.
And you have a better chance of beating it that way. Cervical cancer, we do a pap smear. And I was just speaking with a friend of mine, and they're launching this this test that you can do yourself, actually, called Sheba. So you can actually take the sample yourself and send it in for it to be tested.
Tested for what?
For cervical cancer.
Cervical cancer. Okay.
So it tests for HPV, which is the virus that predisposes us to cervical cancer. So we talked about breast cancer, cervical cancer, and know that with cervical cancer, you can actually be immunized against the virus.
I heard about
Yeah.
that.
So
But
it's
I
available.
guess by a certain age or something.
Yeah.
It's
Actually, yeah. As young as 13, 14, they're recommended that you immunize your child against
Okay.
cervical cancer, against HPV.
Okay.
And the third one is ovarian cancer, and any of the cancers that can happen around your womb area. So
And these things can be detected
they
early.
can be detected early. So you wouldn't feel a lot of the things you can't feel, until then it becomes too late. But with an ultrasound, so parts of your health check will probably just be an ultrasound of your abdominal and pelvic area. So that's
for the women. All right. Thank you, Dr.
Yeah.
Cherish. So I have two gentlemen here,
Yeah.
Albert and Nana Kujo,
Yeah.
taking on behalf of the men.
Fantastic. It will be surprise you to know that one of the top cancers in Ghana is liver cancer.
Why?
Yeah.
Because sometimes I go on social media
Yeah.
and it's like, okay, this
Yeah.
person has liver cancer.
Yeah.
Pretty
Yeah.
young
Yeah.
folks.
Yeah. I think it's really mainly because of one, alcohol. Alcohol is quite big in Ghana.
Okay.
And that tends to cause like cirrhosis of the liver and then like now leads to liver cancer. And
Okay.
anything that affects the liver, really, hepatitis is
Mm.
one of them. That's quite big in Ghana. Malaria.
Malaria.
Malaria is also quite can insult your liver quite a bit. So there's that rate there. So with your health check for men, you may want to do an ultrasound just to check
Okay.
your tummy area.
Okay.
And then the second thing, which is also big in men, is prostate.
Prostate.
So with the prostate, you don't necessarily even need to do an ultrasound. Just check your prostate specific antigen, which you can do with also a prick.
Okay.
It's just like checking for your sugar or something like that. So for the men, that's possibly what you need to be looking at.
Okay.
And finally, the children.
For the children, I have two.
Okay,
I'm sure
great.
there are many listening with children as well.
Yeah,
Let's talk about the children.
it's still fantastic that worldwide children are still really dying from malaria.
Mm.
So that's not something you can check, but something you can prevent and
Okay.
like be like aggressive with
About
it.
it.
Like use all the repellents. Go get that blue net, put it around because it's just painful to see even them just being unwell.
Even as an adult, having malaria is painful.
Yeah. So that, and then children, it does cause complications like cerebral malaria, where sometimes when it's left untreated for too long, they get like complications of the brain. It's just a terrible thing, but it's completely preventable.
Okay.
But I would say the number one thing you need to do for your children is to know their weight.
Okay.
So make sure that we're not missing the weighing, because the weight alone can either be, oh, well, you're not feeding them well or whatever.
Because
Or,
usually, anytime I had, you're not feeding them well. Anytime I heard that.
yeah, it could either be that, or it could be as bad as they have a heart disease, congenital
Wow.
heart disease. And so that shows up in the rate at which they're gaining weight.
Okay.
So you know that at weighings that is dipping. So if you feel that, no, I think I'm doing my best feeding them, but then it makes us look deeper, and it
Okay.
can save you so much trouble if you pick it up early, because it could have been missed at the 1 week and the 6 week review of your child. So as you now monitor their weight, then we're able to pick up anything that you would not have picked up.
Okay.
And it's important to know the weight, because with children, we calculate all their medications based on their weight.
Yeah, anytime they're like, okay,
So,
go stand right
yeah,
there.
yeah, yeah.
to check their weight.
And if you don't know what their current weight is, you go do a rapid test, it's malaria, you're going to give them malaria medication, but you may be underdosing. I mean, I have a personal example. My daughter is slightly taller and heavier than her weight, her age.
Okay.
So we used her age to give her, and we completely underdosed. And I'm a doctor, so
You're a doctor.
it's just good to do the regular like monthly weighing, so you would know their current weight at any
Awesome.
time,
Awesome.
and that would save you a lot of trouble.
Dr. Cherish, these are some great pointers for us. And I just wanted to reach out to, our listeners this morning, for anyone listening who probably has been, there's a question here. It says, how best can you decide on you applying faith when you're medically unfit?
Yeah.
And medical advice as a Christian, a believer as such. I think you sort of touched
So
on
it's
that
like,
earlier.
when should I
but-
like just go by faith, and when should I like, well, I think
So
that
that's for the lady pastor in you or
Yeah.
something.
I think you should know the level of your faith, and you should be honest with
Be
yourself, and not try to walk on the water when you're looking at the waves and you can sink. So you should know your level of faith and not be pushed into feeling guilty that, I'm a Christian, I should be able to believe for my healing. Why am I taking medication? I think medicine is God's mercy, really, to us. And God is so kind, and he's just always looking out for everybody and saying, look, this person may not be able to receive from, but let me give revelation by way of science, and get them help, so that they will not leave this earth earlier than I want them to.
That's
so
a good line. That we will not leave earlier
Yeah.
than we're supposed to.
yeah,
Which means we need to take our checks
yeah,
more seriously.
Yeah.
And as we're launching 2022, right, I hope this session is going to encourage us all. I'm going to do the same. I think I'm going to get in touch with Dr. Cherish right after
Yeah.
this interview so we can book an appointment and get some checks done. But how can we reach out to you for those who are saying, Jennifer, you know what? I've been putting this off for a long time. And I'm
yeah.
listening to Dr. Cherish today. I think I
Yeah.
just want to drag myself
Yeah.
today or this week to the clinic
Yeah.
and get my checks done.
Yeah.
Know where I'm standing. I know what I need to do.
Sure.
How can we
Yeah.
reach
So
you? Arama
we're
Clinic.
at Sakumono. Arama Clinic is at Sakumono MP Flats Junction, Sakumono Estates.
All right.
But one of the things, because we're really big on preventive medicine and all
Mhm.
that, we try to make it as convenient as possible. So we
Sure.
can come to you
Oh.
to do your labs.
Oh,
And
please come
then
to me this week.
yeah, and then I do the reviews by Zoom, and then if I really
Oh.
need to see you, then we book a more convenient time. But you can at
Okay.
least get your foot in the door by getting some of the labs done,
Okay.
and then we do a Zoom, and then we talk about it. It's very
Okay.
convenient. We can also come to you. The doctor can actually come to you if that's also something that you can do. I have a good friend, and he's been trying to do his labs. He keeps saying, "Oh, I'll come."
I will
I said,
come.
"You know, I'll come and
The
take the
I'll come
samples
syndrome.
myself. I'll take it myself tomorrow morning." You know?
Uh-huh.
Yeah, so that's how. If you want to call us to 020 2500 171, and we go to WhatsApp also 0540 315 915, and we have a good website. You can book online and everything. That's aramaclinic.com.
All right.
Yeah.
Let's get ourselves on the right path when it comes to our health this year.
Yeah.
Dr. Cherish, thank you so much for coming on
You are
this
so
morning.
welcome.
All right. And good morning to Aaron, who's been with us the entire time for this interview. Thank you for your contributions as well. Yours, Cobams Asukwo with Ordinary People. I think this one's for people like Dr. Cherish, who are making sure that we're doing what we need to do
Yeah.
to be healthy. Keep being a blessing.
A child.